from the Signature Bank Studios.
If you're looking for the latest news, insight into what it means, and the sharpest opinion, there's only one station in Chicago where you can turn, and it's this one. We're AM 560, The Answer.
All right, we have 2 slots left for our business benefactor to help Food for the Poor, those less fortunate around the world who need food and clean water. We, the people of McHenry County, Mars Medical Equipment, HealthQuest, Twin Supplies, LTD, West Point Financial Group, NJC Machine. These are some of the cool companies who have decided to help those less fortunate and advance their own company by advertising here on the station. What it is a one-time donation, $2,500. I know you've heard us talk about it. Money goes to feed 50 kids for an entire year, provide clean water. But also as a way of saying thank you, we give you 40 one-minute commercials, folks. It is the best deal in all of Chicagoland radio. The person to call is Anjanette Natowski. Her number is 847-472-8951. That's 847-472-8951. Or go to 560theanswer.com/food for the poor. And again, Dan, we have just 2 slots left.
All right. Among those who turned out to light their hair on fire yesterday over the reimagining of USAID that's going on in the Trump administration, to rail against Elon Musk as a Nazi, as Ayanna Pressley did, was a guy from California, Congresswoman named Dave Min. This is instructive because it's very much in keeping with the new Marxist Party's disposition to criminalize policy disagreements. Thankfully, they don't have the same infrastructure they did in the last 4 years to do just that, but the attitude hasn't changed.
Why did Elon Musk want to take control of the payment system? That's the $64 trillion question. And we know why, because he made clear he wants to cut $2 trillion from our budget. Now, if you look at our budget, there's not $2 trillion to cut unless you massively cut Social Security and Medicare, and that is what he's after. And now he has the ability to shut off your Social Security and Medicare, any payments he wants with the flip of a switch. Obviously, he has control of our information as well. He has broken the law time and time again. This cannot stand. He must be held accountable. He must be made to pay. We must enforce the law.
Yay. Right. And then the chance lock him up started, of course. You can throw Medicaid in there as well, the big entitlement programs that are sacrosanct to the D.C. ruling class. For more on healthcare policy specifically, since he invoked Medicare, and he certainly would include Medicaid, and they do, please be joined by Sally Pipes. She's the president and CEO and Thomas W. Smith Fellow in Healthcare Policy at the Pacific Research Institute. She has a new book out, The World's Medicine Chest, How America Achieved Pharmaceutical Supremacy and How to Keep It. Sally Pipes, thanks for joining us. Appreciate it.
Well, thank you for having me.
Good morning. You can tackle the Medicare piece too, but Medicaid is a specific interest to me because combined federal and state program. And, for example, in Illinois, the Medicaid rolls have ballooned to where we're approaching 1 in 3 Illinois residents on Medicaid, a program that was designed to provide health care of last resort to pregnant women and indigent individuals and so forth. But it's just during COVID and generally speaking, varying state by state to some extent, it's just been expanded beyond all recognition and financeability.
Well, absolutely. And I mean, because of IRA and the Biden administration, COVID, particularly under COVID, 80 million Americans are now on Medicaid. A lot of those people, should not be on Medicaid, but they don't take a job or they don't take a job with a salary increase because they don't want to lose their Medicaid coverage. And there's, as you've probably read many times, there is so much fraud in the Medicaid system. Mm-hmm. And now the federal government, since COVID, is paying 90% of the cost. And so President Trump needs to make changes to Medicaid, and in particular to bring in back the whole idea of people that are not chronically ill or indigent or whatever, or pregnant women. We need to get back to the idea of these people getting them back to work, cut the rolls, the Medicaid rolls, and to leave the program for those people who actually are low income and actually need it. It's completely out of control, heading towards, costing over $800 million a year.
Well, and this is billion a year, right? And this is, when we look at the $1.8 trillion deficit just last fiscal year, you're talking about these entitlement programs that are unsustainable in their current form. And of course, you have politicians digging in, as you heard, but this is the opportunity to expose and educate the American people a little bit about this program. Here's what it was intended to do. Here's where we're at now. All we're saying is let's get back to where we used to be, the original mission of the program.
Right, and the federal government was paying up to 75%, and the states between 50 and 75, and the states were paying the rest. But now the states are off the hook, and it's hugely out of control, as we just talked about.
And that doesn't even include all the people that are getting health care under Medicaid who are in this country illegally.
Well, exactly, and particularly if you live in a state like California, it doesn't matter whether you're legal or illegal. You are entitled to coverage in California by the Covered California and the state government, which is absolutely ridiculous. Is it any wonder why so many illegals migrate to California? Because they get free health care coverage, and the weather normally is pretty good.
Yes, and it's the same story, not the weather part, but the same story in Illinois. I wanted to get your take on RFK Jr. as the prospective HHS secretary, particularly in relation to your book about big pharma in this country. The concerns you have, if any, about RFK Jr. and the opportunities you see with him.
Right. Well, a week ago, I thought that perhaps he was not going to be confirmed. You saw newspapers, the editorial page of the New York Post, the Wall Street Journal, very much against him, a lot of doctors' groups against him. I didn't think he would be confirmed, but just yesterday, Senator Bill Cassidy, who is a medical doctor, decided he agrees with, that he has commitments from RFK Jr. on the whole vaccine program. So I'm skeptical. I think the whole idea of Make America Healthy Again is a good idea, but what he's done in the past, and I think what is his real raison d'etre for being, is that he thinks vaccines are bad, and he would like to have them, eliminated. But look at what would young people do without the polio vaccine? I was fortunate as a young person to get the polio vaccine, smallpox. We eradicated those illnesses. With RFK Jr., if he got his way, is what he really believes, this would be a huge setback for not only people in America, but all over the world, because vaccines have been such a great rescuer for so many. And so he says, well, he had his own children vaccinated. So how is it that he's, such an anti-vaxxer? And I don't believe government should mandate that people, get vaccines, but it's great that the drug industry has them available. And if you want them, you can get them. In California, whooping cough, which was eradicated years ago, so many mothers watching television, RFK Jr. think, oh my gosh, I can't get my child vaccinated for these things. They'll become autistic or whatever. And whooping cough is on the rise. That disease was eliminated. But now, so I don't know, but it looks today like this, because Senator Cassidy is up for re-election this year in the Senate, that he sort of caved in. So I expect that we will see the confirmation of RFK Jr. I'm not excited, but we'll have to wait and see. There's some very good people that are going to be, I hope, confirmed. Marty Makary for the FDA, Jay Bhattacharya for the NIH.
Yeah. And Dave Weldon at CDC. That's why I'm a little bit less concerned, is because the people that are around him in those public health agencies too, that have a much different perspective than his historical one.
Right, and Jim O'Neill is up to be the deputy secretary, and he has done very good work over the years. He worked in the Bush administration on health care. He knows the industry very well, and so one would hope that he would have some sway over bad decisions that RFK Jr. might want to introduce, and particularly in the vaccine space.
Well, what about the industry in general? Pharma it did not exactly cover itself in glory during COVID. And so there's, a lot of understandable antagonism in the direction of companies like Pfizer for how COVID proceeded. And so I mean, what kinds of approach or new approaches to the industry should be taken?
Right. Well, I mean, of course, America, between Pfizer and Moderna companies, I mean, the vaccine came to our country very, very early and was able to export to other countries that did not have a vaccine. So in a way, I mean, I think, we have to be thankful for the pharmaceutical industry and the Pfizers, Modernas, the Novo Nordisk of the world, because, today, 80% of R&D in the pharmaceutical industry is done in America, and only 16% in countries like Europe, which have price controls. So we want to keep the price controls away, and I'm hoping that President Trump will urge Congress to repeal the Inflation Reduction Act and the price controls on Medicare drugs under Parts D and B, which, of course, the first price controls don't go into effect until January 1st, 2026. But if you look at the whole issue, we need to tie the reimbursement rate to the effectiveness of the therapy. So if a therapy is not working, then, there shouldn't be reimbursement for it. We need to require manufacturers to refund a share of the price of disappointing therapies and perhaps spread the pain out over time so that people, that don't have coverage. But, most people today have coverage either through the government or through their employer-based insurance, which 180 million Americans do. So, when you see Bernie Sanders get up on the stage and say, the list price of this drug is, $600 a month for, say, Eliquis, but very, very few people pay the list price. Most people pay the net price, which is very reasonable because after rebates and discounts, the price comes way down. Plus, the real problem is to reform the pharmaceutical benefit managers, the middlemen between the insurer and the drug companies who negotiate the prices for these drugs to go on the formularies. And in most cases, the PBMs want the rebate price to be higher so that they get more money. And the money goes to the insurer and the PBM and not to the patient. We need to make sure that all of these discounts and rebates are reflected at the drug counter for patients and not for insurers and middlemen. So, and then also we need to look at risk pools for some of these very, chronic diseases, some of these very difficult diseases. We need to have special risk pools so that those people can actually get access to the drugs and the rest of the population doesn't have to share in the cost. So those are my ideas for reform, PBM, 340B, tying reimbursement to effectiveness.
Sally Pipes is the president, CEO, and Thomas W. Smith Fellow in Healthcare Policy at the Pacific Research Institute. Her new book, The World's Medicine Chest, How America Achieved Pharmaceutical Supremacy and How to Keep It. Sally Pipes, thanks for joining us. Appreciate it.
Thank you very much. Bye.
Thank you. And she joined us on a turnkey.pro answer line.
This is the morning show more Chicago radio listeners are choosing. This is Chicago's Morning Answer on AM 560. The Answer.
It's your life, your legacy. Shouldn't it be your choice? For nearly 2 centuries, Catholic Cemetery Chicago